And, you know, the test I always used was if you had a cold and you saw 50 quid blowing around on your lawn outside, you'd get up and you'd go out and get that 50 quid. If you have flu, you'll be so unwell, you won't be able to get out of bed to get that 50 quid. So the important thing is that we don't allow flu to ruin people's Christmases and New Year. And the best way to do that is to get vaccinated. So vaccination is the key.
So what is the current situation within Manchester, Greater Manchester with flu?
So the flu situation is really serious across Manchester, particularly over recent weeks. What we've seen is high numbers of patients attending our emergency departments, and a significant number of those are testing positive for flu. The strain of flu is flu A. I think the really difficult thing is that flu A causes some extremely unpleasant symptoms. And we often confuse, don't we? Flu and a cold. You know, if somebody says they've had flu a few times this season, they've not had flu, because you know you've had flu. If you have a cold, you get a bit sniffly, running nose, coughing and sneezing. Flu symptoms can come on really quickly, and typically you get a really severe headache, you get high temperatures, you get muscle aches. And, you know, the test I always used was if you had a cold and you saw 50 quid blowing around on your lawn outside, you'd get up and you'd go out and get that 50 quid. If you have flu, you'll be so unwell, you won't be able to get out of bed to get that 50 quid. So the important thing is that we don't allow flu to ruin people's Christmases and New Year. And the best way to do that is to get vaccinated. So vaccination is the key. We've already given out across the NHS millions of doses of free vaccines to those that are eligible for the free vaccine. The vaccine uptake is about 40%, but there's an opportunity now, as numbers over recent days are falling off. We're anticipating that there's going to be a second spike. So we've been through that first spike, which has seen record numbers of patients hospitalized at this time of year, but numbers are falling a little bit over this past week. We can't be complacent. We can't be complacent. Now is the time to get your free flu vaccine if you're eligible, and if you're not eligible, so if you're under 65 and not a child, you don't have a long-term health condition, or you're not pregnant, you can actually buy a flu vaccination. You know, they're 15 or 20 quid, so the price of a few pints, and you can book through the NHS 111 app. Most high street pharmacies will provide that flu vaccination service.
And what is it about this flu A? Why is this sort of, obviously, because, you know, we get flu every year. People are asked to go for the vaccines every year. But why is this stand out? Because for me, the last time you heard some of the terminology, I suppose, and some of the discussions that's currently being had was back towards COVID, when you're having, you know, there's more publicity around weekly, daily flu figures. There's talks of masks. What is it about this flu?
I think it's because the symptoms it causes, it's extremely disabling. People can become extremely symptomatic. Those symptoms are very unpleasant. As I said, severe headache, high temperatures, muscle aches, enormous fatigue, that sense of not being able to do anything. And in some patients, then it's complicated by inflammation of the airways and inflammation of the lungs, we call pneumonitis. And that leads people to be susceptible then to secondary infections with bacteria. Flu is a virus, but if your lungs are damaged and inflamed, you're more likely to succumb to bacterial lung infections as well. So we're really concerned about this flu strain, and it's really important people get vaccinated as soon as possible if they want to avoid their Christmases and their New Year's being ruined.
And in terms of the people that are, you know, currently being admitted to hospital and coming to A&E, what sort of, you know, is it these people that you said that have got underlying conditions, or are you having perfectly healthy people in terms of, you know, ages? A lot of the time you sort of assume it's, you know, older people, but what is the age range of patients? Is it everyone that's being affected this year?
Yeah, it's a really good question. We're seeing children, unvaccinated children and adults become very unwell with flu. We're seeing a range of patients presenting. Some patients who have a degree of frailty or chronic health problems can be very susceptible to the effects of flu. We're seeing some quite sick children, but we're also seeing young adults who are literally just flattened for days. And you know, that's really problematic for all sorts of reasons. One is that, you know, that means that our emergency departments can risk being overcrowded. But the other thing is that, look, if people are, you know, particularly if you're self-employed, if you get flu A, you're going to be out of work for, you know, at least 4 or 5 days a week, 2 weeks, because you're going to feel too ill to work. So we're really urging people to get vaccinated.
And in terms of the record admissions, what impact is that having on the wider hospital network in terms of operations, staff?
Yeah, well, we're coping, but the services are under strain, and you know, the staff who work on the wards, nurses, medical staff, you know, have really sort of, you know, psychologically, emotionally demanding work, and you know, extra burden is placed on them if they're coping with higher numbers of sick patients. But also, we've got to be very mindful of the impact that flu has on our workforce, and that's why we've been really driving and encouraging our workforce to take the flu vaccine. And we've been doing that since summer this year. So one of the things that we do is we keep a very close eye on the pattern of flu in Australia, because their winter comes earlier. And what we saw was an earlier spike of flu in Australia. So that meant we could plan what sort of vaccine to produce. And it also meant that we started driving our vaccination campaign and are thinking about how we organised ourselves to vaccinate staff sooner.
And obviously at the moment you do have the resident doctor strikes, which is, you know, taking a chunk out of the workforce as it is. With luckily, as you said, you know, there has been this dip, which has probably, you know, been quite good in terms of timing. But how is that affecting things?
Yeah, well, again, the system is coping, but it's under strain. What happens when there are periods of resident doctor industrial action are that our consultant workforce and other clinicians step into that space. So services are working, emergency services are working as normal. We're maintaining most of our planned activity, but I'm always very mindful that we're asking people who are working very hard and have worked very hard all year to do more for us. And that leaves staff feeling, you know, they can feel, you know, exhausted, tired, and you know, we've still got, you know, a few months of the winter to go, so we've still got some hard work to do over the coming months.
And if you have flu or you suspect you have flu, what should people be doing? Obviously, in extreme cases, you know, people will need to come to hospital. But if you are just generally unwell, what would you recommend people do?
Well, what I would say is there's advice on the NHS 111 website, and there's advice through the NHS 111 service. But look, some of this is about common sense, isn't it? Because we talked, didn't we, about that there are a lot of colds around at the moment, but there's also flu. So, you know, if you're feeling unwell, if you're coughing and sneezing, you know, if you can avoid going out, don't go out. But certainly take precautions around spreading infection or avoiding spreading infection. If you're going to sneeze, sneeze into your elbow. You know, catch sneezes in tissues and then dispose of them. Wash your hands frequently. But ideally, it's taking those sensible steps not to go out. If people are worried about themselves or about relatives, the important thing is to access the help that's out there. So NHS 111, GPs are offering more appointments and more telephone advice than ever. That's the kind of the principles of the advice I'd probably give Sam. Stay hydrated. That's the other one. Stay hydrated.
And obviously, you talk about using common sense. There has been a lot of discussion surrounding masks. What are your thoughts on people wearing masks, particularly, you know, in hospitals or in other, you know, public areas that are where you have got people potentially who are at risk?
Yeah, no, really good question. So look, we have infection prevention control guidelines that trigger in terms of when our staff will be wearing masks and what masks are the most effective ones to wear. And I think people coming to our emergency department, they'll have seen over the past few weeks, many of our staff will be masked up to reduce the risk of infection. I talked earlier about, you know, if people are symptomatic, ideally stay at home. But if that's not possible, and of course there'll be many people where staying at home is not an option, you know, choosing to wear a mask is an option, because that does reduce the risk of transmission of viral respiratory viruses. And of course, influenza, flu, and flu A is a respiratory virus.
And lastly, this is just a quick one in terms of, obviously, as you've mentioned, the people are able to get flu jabs through private services for, you know, £15, £20. Are there any particular roles or, you know, areas of work that you would recommend people within those jobs, for example, or environments taking advantage of these jabs?
I think because the symptoms of flu are so serious, because it is so prevalent, I would encourage everybody to take up the opportunity of a flu vaccine, a free flu vaccine if you're eligible, and buy yourself one if you don't. But, you know, look, if in your job you are spending time with other people, your risk will increase, and the more people you spend time with, particularly in close contact with, the higher the risk. But I'm encouraging people to take up the free flu vaccine or organise a vaccine for themselves, because flu A is very serious, and I don't want it to spoil people's Christmases and New Year. And
sorry, I know I said lastly a minute ago, but worst case scenario, what would you say, you know, if people don't get the jabs and we do see this next peak of flu, what is the worst case that we're looking at over the next month or so?
Well, look, we've been planning, we're having this conversation in Manchester. I'm at the Oxford Road campus near to Manchester Royal Infirmary. We've planned as a system in Greater Manchester how we respond to escalating levels of demand. We work very closely with colleagues in primary care. We work very closely with the ambulance services, and we've got plans for all eventualities. So what we do is we've got an excellent virologist who is very close to the national data on flu prevalence and incidence, and very close to what's happening in Manchester around flu prevalence and incidence. And we're having data-informed conversations about our plans for managing flu on a day-to-day basis. So we're staying very close to the detail of what's happening with flu numbers.
And would you say there has been lessons learned from COVID in terms of, you know, the management of things such as this?
Oh, so absolutely. In terms of the risk of overcrowding in emergency departments, spreading infection. But look, I think the other thing is we've got to realise that I still think generally the public are we're suffering from the tail of some of the concerns that came out of the COVID pandemic. People may be a bit more hesitant about vaccines. People are a bit more hesitant to use masks. But we do know the best way to avoid getting this serious flu A virus is to be vaccinated against it. The vaccine gives a very good level of protection.
Fantastic. And if you could just 30 seconds sum everything up, what is happening, what do people need to do, and how important it is?
Thanks. Flu A is very serious, and the symptoms of flu A are very serious, and we're seeing very high numbers of flu across Manchester and have done over recent weeks. I don't want flu A to ruin people's Christmases and New Year, because if you get it, it will ruin your Christmas and New Year. The best way to protect yourself from it is to get vaccinated. Many people will be eligible for a free vaccination, and if you're not eligible for a free vaccination, you can book yourself a vaccine through the NHS 111 website or the app with a high street pharmacy, or walk into a high street pharmacy and see how you can get a flu vaccine.